In this video, we're going to talk about how we provide services to people with HIV and why addressing HIV stigma is so important. In terms of providing services for people living with HIV, very importantly, you've got to start with testing. If people aren't tested and don't know they're HIV positive, then we can't help them, and they're possibly going to spread HIV to others. In Africa, usually we use two tests to back each other up. Depending on where you are on the continent, Uni-Gold and Determine are two commonly used two tests that you try to have two positive tests to confirm if someone is positive. The rapid tests are there, but you also have to provide the counseling to get consent and prepare people. This is something we call VCT, or volunteer counseling and testing. People should not be forced to have HIV tests, so there needs to be counseling involved and it needs to be confidential. Stigma is a huge issue with HIV. When people test positive, what happens? If you're ashamed to have HIV and you don't want to tell your partner, you don't want to tell your family, you might go into hiding. Why does stigma matter? Well, it influences health-seeking decisions, and it means people might not go in for care because they're so afraid of being revealed. We call this disclosure. Many people don't want to disclose to anyone. Stigma prevents services from being provided. Where does stigma come from? This is a bigger discussion, but some people in Africa suggest that the way that the original public health approach to HIV in much of Africa was done really stigmatized HIV. It focused on sexual practices, and people began to think, well, if you have HIV, then maybe you're a sex worker, maybe you've been a client of a sex worker, maybe you've done something immoral. We don't know exactly where stigma comes from, but a disease that's associated with sexual transmission is likely to have stigma attached to it. Some religious beliefs and perceived morality issues around sexuality are huge barriers. We've had tremendous stigma in the United States around HIV, and it continues to be a problem. People might think that if you're HIV positive, again, that maybe you've done something immoral or something wrong. Trying to combat these erroneous beliefs is so important. And there are social and legal norms in many societies in which homosexuality is still criminalized. Homophobia is a huge problem in many countries, including the United States. Men who have sex with men and other sexual minorities and marginalized gender identities are further stigmatized. They may not seek out HIV care or get the treatment they need and deserve. Finally, inequality in class, gender, sexual orientation, ethnicity, and race all can influence HIV stigma in ways that prevent people from getting tested for HIV and then treated and supported. The good news is that we have a treatment, not a cure, but a treatment for HIV infection that can both help those living with HIV to have full and healthy lives and also prevent transmission of HIV to others.